we're going to talk a little bit more about oral motor. There's a reason why I want to discuss oral motor, and it's because it has such a bad reputation in the field of speech pathology. So as speech pathologists, it's almost hammered into us that oral motor exercises don't do anything to improve speech, right? It's not directly correlated with what we need to do to improve articulation. The problem is that not all oral motor exercises are created equal. So yes, there are things out there that really, at the end of the day, does it benefit your patient? Is it really serving a purpose? Does it improve muscle strength? Does it improve coordination? Maybe, maybe not. I can't tell you. It depends on what you're choosing. However, in our practice, we do incorporate the Beckman Oral Motor Exercises. The reason that I'm such a big fan of the Beckman Oral Motor Exercises is because it is one of the few oral motor exercises that is based on research. And the research has shown that it does improve strength. It does improve coordination. Now, if we're working on speech, if we're targeting speech, but we have a lot of muscle weakness, then our speech is going to be impacted by the weakness of our muscles. So if we can't really close our lips with a lot of strength to be able to do the p or the b sound or even then we have a problem, because it's gonna distort your speech. You're gonna have like this. You're not gonna be able to put your lips together with enough strength, or even round your lips, or what we call like lip spreading, which is like ease, smiling. It's all affected by muscle weakness, which is where the Beckman comes in. You don't do the Beckman. The Beckman on its own is not going to automatically improve articulation. It's the Beckman in combination with whatever you're doing to improve articulation. We tend to combine the Beckman or motor exercises with the prompt technique. And I just find that that's such a beautiful combination, and it works so well for the kids. The 20 years that I've been in practice, I've probably been using the Beckman Oral Motor Exercises for a good 15 of those years. And it just has made such a difference to my practice. So it's something that we do promote here at Speakeasy for Kids, because of the benefits that we've seen and the improvement in speech when it's combined with something else, or when it's used prior to doing feeding. So it's kind of like, let's warm up the muscles of the mouth and now let's do feeding. So definitely, it's not that all oral motor exercises are going to work, but there are some out there that are excellent, and I would highly recommend. My favorite, again, is the Beckman Oral Motor Exercises, which were created by Deborah Beckman. So either your speech pathologists that are out in the field, even for occupational therapists that are out in the field, if you're working on feeding, for parents that are struggling to brush their children's teeth, or are struggling that see that their kids gag every time they put food near their mouth, this is something that does actually help with all those areas of concern.